A potentially deadly disease for dogs has been confirmed in South Florida. The University of Florida is currently treating several dogs for canine influenza. The recent outbreak started at a dog show in Georgia, but made its way to Volusia County and now spreading south. Here to talk more about this potentially deadly disease is Dr. Christopher Lapsley from Village Animal Clinic. This is something all pet parents need to hear about.
Yeah, all pet parents, dogs and cats, we need to be aware about
We'll
this
get
guy.
to all that in just a moment. Let's start with very simply. Hi, Egon. Egon's here too, by the way, today. What is canine influenza?
Canine influenza is an upper respiratory disease in dogs. It's very similar to the flu in people. Dogs can feel a bit junky for a couple days. There can be coughing, sneezing, nasal discharge, and fever. It can last a week, maybe more than 2 weeks in some of these cases.
And it can be fatal.
It can be fatal. It can progress to a really aggressive pneumonia. It can require hospitalization, and that's what we worry about.
Can dogs get a flu shot like people can get a flu shot?
Dogs can get a flu shot, and that's what we're starting to encourage. And just like people, the strains of flu are different every year, so it's not always the same. And dogs that do get the flu shot can still get the flu.
Just like people.
Just like people. However, the symptoms tend to be a little bit more mild.
And easily treatable. Then.
Easily treatable. Usually what we're doing is treating the symptoms and whatever we need to do, providing supportive care. There's not a shot or a vaccine, or not a vaccine, sorry, an antibiotic that we can give these guys to turn it off.
Dr. Lapsley, I think about right away, especially in South Florida, as this is spreading here, we've got high-rise apartment buildings where all the dogs are hanging out in a common area around the apartment building. We've got dog parks everywhere. I think about the one I go to in Wellington all the time. It's packed with dogs.
Absolutely.
Is this a concern?
It is a concern, and that's where we worry. We worry about the high population and the density of dogs. That's where these guys can pick this up. If you have your dog that stays at home, he's in your backyard, we don't need to worry about that dog for the flu. But what we do need to worry about is dogs that travel, dogs that are in contact with dogs that are doing dog shows, agility, dogs that go to the groomer, daycare, dog parks. Those are where we can see this spread.
We talked about the flu shot, but
Yes.
are there other ways we can prevent it?
The biggest prevention is going to be separating your dog from dogs that are sick.
Okay.
Kind of just like us, but it's impossible to know. You're walking down the street, a dog walks up to you. All it takes is a sneeze. And this virus, it is easily killed, but it can travel on a sneeze or a cough 20 feet in the air, and it can live on our hands, it can live in the environment for up to a day.
We can't get it from our dogs, though, can we?
Humans will not get it, but cats actually can get it.
Okay.
Cat form is much less severe, and we're not very much worried about that. We're really focused on our dogs at this point because they are the ones that are suffering with this.
Let's go through, just before we go, one more time, the symptoms. And it's, even though it's summertime, this is something that is spreading to this area now, so parents, those of us who are pet parents, don't have to think, well, it's not a wintertime thing like we think about for people.
With our human flu, we think about winter, we're all inside, that type of stuff. Now as we're traveling, our dogs are going up north, they're going through the counties, they're going to Georgia, things like that. That's when we see this. So that's going to be the biggest thing, and we want to, again, do our prevention, we want to do our vaccines, and that's where we're going to focus on that.
And if your dog is acting like he's just a little bit out of it, get to the vet right away, because then you can treat it.
Coughing, sneezing, lethargy, fever, especially if it's going on. Call your vet first, though, so we can prepare when you come in. We don't want just a walk-in on this, so we can disinfect and be prepared for these guys that are coming in.
Dr. Lapsley, thank you so much. Egon, you're liking this TV stuff. Thanks for joining us, both of you.
Thank you.